So today I'm going to teach you how to administer insulin correctly. And so the objectives of this lesson would be to teach you how to administer insulin correctly and teach you the different areas where you can administer insulin.
Okay.
So did you just graduate from college?
I did. I graduated last year.
Okay, awesome. I know that's exciting.
Yeah.
Okay, so that would be a strength for her. She has college education. But do you know anything about insulin and how to administer?
I had no idea that I had any problems with diabetes or anything like that. It's totally foreign to me.
Okay, so we'll work on that today. Okay, so this will be considered a weakness since she doesn't really know too much about it, so we're just going to inform her today. And so, my name is Anita Bowens, and I'm a student nurse. Okay, so you're going to get your supplies. You have 2 alcohol swabs here. You have a syringe here.
Okay.
And then this is just going to be an extra syringe for when you demonstrate it back to me. And then there's the insulin, R. And this is we're just going to use this as skin.
Okay.
Okay. And then this is the container that you're going to dispose of. We're going to dispose of the needles. But at home, you want to find like a plastic container or like a metal container with a lid on it to dispose of the needles.
Okay.
Okay. So, and we're just going to put this on the side there. So now that we have all of our supplies here, you want to make sure that you always wash your hands because, this is an important procedure and you don't want like any kind of infection. So you want to make sure you always wash your hands. And you're going to check the bottle, check for the expiration date, Okay. So then like usually there's a cap on here and you're just going to pop the cap off.
Okay.
Okay. And then you're going to take an alcohol here and you're just going to wipe this top off with the alcohol. Okay. So then you decide how much insulin you're going to need. So for demonstration, we're going to use 20. Okay. So you take the lid off. Always when you're going to take some insulin out of the bottle, you want to make it even. So if you're going to take out 20, then you want to put 20 air in there.
Okay.
Do you understand what I'm saying? Mm-hmm. So if you wanted to take out 10, how much air would you have to put in here?
10.
10, yes. Okay, so here I'm going to pull back to 20, and you're going to look at this top line right here.
Okay.
You make sure it's 20, that's 20 air. Mm-hmm. Then you're going to inject it in here, and then you're going to turn them both upside down and you're going to pull back until you get to 20. Okay.
Okay, so there's 20 units of insulin in the syringe. Okay.
Yes. Okay. So then you take it out, and you want to be very careful with the needles. Always cap the needle, cap it with one hand because you can always poke yourself if you use 2. So just be very careful with that. So you just place the cap back on it, and now you're gonna prepare to inject it. Okay, so the places that you want to inject insulin is you would do the abdomen, the back of the arms here, and then you would do the lateral thighs here, and then you will also do the upper butt.
Okay.
Okay. So the most common place is the abdomen. So when you're going to administer insulin, you pick the left side and you rotate it 7 times in a circle.
Okay.
7 different times. So the first time you do here, second time, and you go clockwise. 7 times.
Around the belly button?
No, on the left side.
Okay.
And then once you've completed seven injections on one side, on the left side, then you go to the right side and you do the same thing. You do 7 injections on their right side, and then you just go back and forward once
Okay.
you've completed 7 injections.
Okay.
Okay. The site that you're going to go to, you take the alcohol and you clean the area. Then, since we're pretending that this is your skin, you choose the area and you're going to clean it. Okay. Then you're going to take your insulin here. You're going to take the top off. Okay. And then you're going to squeeze it, and you're going to inject at a 90-degree angle, meaning just kind of straight like this. But if you're going to do your abdomen, it will be like this. Okay. So you're just going to go straight in, let go, you're gonna hold it, and you're gonna go very slow. It's very important to go slow because you can mess up your skin like that. So you're gonna go very slow, and once you're finished, you're gonna wait 5 seconds.
Okay.
So then after 5 seconds, you're gonna release it,
Okay.
and then you put the safety. Okay. So then you make sure you always make sure you do the safety. Okay. So then you have your container here, and you're just gonna dispose of it in there.
Okay.
Okay. So the things that we've just went over is we talked about your strengths. Okay. We gathered all the supplies that we needed. We prepared the insulin. We prepared the insulin. We administered the insulin. And we talked about the different sites that you would use, and then we did the injection. Okay, so now that I've demonstrated it to you, I want to take a look to make sure that you understand everything that I've just told you, because you will be doing this at home, and it's very important for you to understand the steps.
Okay.
So here are your supplies.
Alright.
And if you have any questions, just let me know, okay?
Okay. Alright, I think I'm gonna wash my hands before I do this, because I don't want to get an infection. And then I'm gonna check expiration dates on my supplies and make sure they're not expired, and make sure I have the right type of insulin. Okay, I'm gonna take an alcohol swab, and I'm gonna swab off the top. Oops. I'm gonna swab off the top to get all the germs off, and then I'm gonna open my syringe, and I need to put air into the bottle. So I'm gonna draw back
yeah.
the amount of air I need. Okay. And then I've already wiped the top off, so I'm gonna take the top off and I'm gonna put the air in. Okay, and then I'm gonna turn it upside down. Oops, it's a little tricky. I'm gonna
Very
pull
good.
back on this thing
Okay.
until I get the amount I need. And then, okay. Now, I put the top back on because I don't want to poke myself. One hand. Oh. Okay. All right. And then I would take the swab and I would clean the area. Like if this was my stomach, I would open this up and I would clean it really well. And I would take the top off. And I
Do you
would-
know what areas you would?
Oh, probably my stomach in like the clockwise pattern. All the other areas would be hard for me. I think I prefer to do it in my stomach because I wouldn't want to do it in my leg or the back of my arm. So I'm going to do my stomach, and I'll just rotate 7 times on each side in a circle, back and forth. And I'll pinch the skin, just make sure there's enough, and then I'll quickly put it in, and I'll hold it there, and I'll push it in, and I wait 5 seconds.
Yes.
Okay, and then I can pull it out, and then I activate the safety thing, and then I'll just discard my syringe in my container.
Perfect. So you were able to demonstrate that how to administer insulin effectively to me. So that objective was met, and you did state the correct injection sites to administer sub-Q injections.
Okay.
So we don't need any kind of follow-up or anything. I think everything is, I think you followed everything good, so I think, we don't need any kind of follow-up teaching.
Okay, great.
So if you could just initial right here for me.
Okay.
And do you have any questions for me?
I don't think so. I mean, was pretty simple. I think I've got it down.
Okay, awesome, okay.
Thank you.
No problem.